Hi everyone, Dr. Traci here. Today's topic is building a rapport with clients, which also means building trust. This is key and the foundation of everything we will do. If we don't have that, we cannot even expect, should not expect, real progress in healing in therapy. This is the basis of what we do, and this is exactly where it starts. And building a rapport in client even starts with when they first contact us for an appointment, when they're doing the intake work, any sort of communication at all. In fact, you could even go even further back and say it starts with how we present ourselves online, with our website, with social media, pictures, posts describing ourselves, our services, our treatment method, all kinds of things like that. They're already making judgments about us before they even actually meet us in person. But in my opinion, where you want to begin is with Carl Rogers and Rogerian style therapy. He is the founder of person-centered therapy and unconditional positive regard. To me, this is the foundation of therapy. And of course, this is my way. Okay, this does not have to be your way. So I'm going to speak from my experience and what has worked for me. I come from the theoretical background of being an equal partner with the client and collaborating with them. In fact, I don't really even go by doctor. Most of my clients just call me Traci. And I prefer that. Usually if they do say doctor, I'll correct them and let them know that you can just call me Traci. And that is because it puts me on kind of like a higher playing, like as if I'm an authority figure over them. And it's important to realize we are not an authority figure over our client, right? The client is their own authority figure. They're the ones that are going to know what is best for them, and they're the ones that have to make that decision, because they're the ones that are going to have to live with any and all decisions they make and the consequences or benefits to those decisions. So to me, it's very important that we present ourselves as an equal partner. And sometimes I even explain that to them. And a lot of people will come to therapy with a lack of self-esteem and being able to stick up for themselves, and they're kind of coming to us for answers. But it's kind of like that old saying where you want to teach them to fish as opposed to giving them the fish, some sort of phrase like that. I know I got that wrong, but hopefully you know what I mean. So where our goal is to actually get them to a point where they don't need us anymore. So in being taught a lot of theories in school and about the different treatment interventions, we can get pretty overwhelmed and confusing. It can get confusing about where to start. But, I kind of say when I'm supervising therapists to just kind of put that in the background. Don't let that come before the client that is actually sitting in front of you, right? Don't ever forget that there is a human being sitting right in front of you in great need, looking to you for help, right? And that is the most important part, right? Don't worry about what interventions you're using and how to use it. Just be sincere and compassionate, and just begin to ask questions and learn about them, and show acceptance and positivity, and try to give them some hope, and let's move from there. And then afterwards, you can kind of look back and review the session, like when you're doing the progress notes, and you can ask yourself, what did I use there? Was that CBT? Was that DBT? Was that some motivational interviewing? Maybe it was a combination of all three. But I don't think the intervention should lead your interaction with the client. It should be the other way around, right? You lead naturally with the client, and then you go back and determine what you did, and then you can write that for the notes. It can be helpful to see ourselves as a moderator or a conduit we are guiding them through this process. We're not leading them, but we are helping them, walking beside them in a sense. So this also means that we're not responsible for their progress or lack thereof, right? Because that is on them. Even when people thank me for their progress, I quickly correct them and let them know that it was not me, because the reality is that I can, somebody can come to therapy, a couple days a week, and whether they make progress or not is not really dependent on the amount of therapy that they participate in. It's really about the work they do outside of therapy. And this is also why giving therapy homework is a great idea and just so important, and an important step that can help people make progress a lot quicker. So, and we will talk about therapy homework in another episode. But yeah, when somebody makes progress, that's on them. And the same thing when somebody lacks progress, that is also on them. And we want to hold them accountable and responsible when they are not making progress, which means we can't have it both ways, right? So when they're making progress, that is also on them. And it's important to make sure that they are aware of that. And it also helps us with our own boundaries, because we also could not continue to do our job well if we are taking responsibility for a client's successes or failures, right? We are just kind of like a middleman there to assist them through their own journey and support them on it. So hope this helps. This is a great way to just build rapport and trust with the client, letting them know that we are, fully unconditionally supportive. We are an equal partnership. We collaborate together. In doing this, I will even kind of just, even if I do have an opinion on something, I will let them know. I'll say, you know what, I'm just going to share my thought process, or I'm just going to kind of think out loud. If you can give me some leeway here, some flexibility, and let's just talk this through together. Right? Make it a collaboration, just like you would, at a job, if you're like in a team meeting, right? Because it is, and this is their life. So, we can't expect to meet with somebody, 45 to 50 minutes, and then, have this, perfect answer for them and have all the answers of what they should and shouldn't do, right? All we want to do, we just want to give them that acceptance, the encouragement, the feedback, the guidance, and then empower them to go from there and take it and run with it between sessions, and make those decisions and be confident and build that confidence within themselves. Okay, I hope this was helpful. Please let me know if there's any questions, or if you need more guidance on that. Any other topic ideas would be great. All right, I'll see you guys soon. Bye.